The denture pain instant relief. It is highly certain that digestive process may suffer from many problems in your teeth, cannot operate well. Despite understanding clearly about the fact people still engage themselves with the habit of eating sweet foods, leading them to the deal with many teeth-related issues, including tooth loss. Hence, they have to rely on the denture to solve their problems. Fact that shown that the dentures can be very beneficial, but we still get many inconveniences due to their appearance, especially in the early using time. In particular, pain as well as swelling are two unavoidable symptoms usually associated with dentures. Moreover, there are several issues coming from the denture which can be listed as white patches of the yeast, dry mouth or gum sores. Following are the top 5 tips to get rid of the denture pain and the people can really totally rely. Massage your gums. To reduce the gum swelling, gently massage the gums will help a lot, and massage encourages the blood circulation which reduces the swelling as well as pain. For massaging the gum, you can use olive oil which has anti-inflammatory properties. Rub your olive oil directly on the gums and use your index finger to gently massage your gums for a few minutes. Wait for 5 minutes, then rinse it off your mouth with lukewarm water. Repeat 2 to 3 times daily until you get the relief from the pain. Number 2 is oil pulling. Oil pulling is an age-old practice that supports the oral health by removing the harmful bacteria from your mouth. It helps to keep your mouth moist and prevent dry mouth, a common problem among denture users. It even helps to eliminate the bad breath and reduces the gum swelling. Put 1 tablespoon of the old pressed vegetable oil like sesame oil in your mouth. Make sure not to wear your denture while doing this. Swish it around your mouth throughoutly for 10 to 15 minutes. Spit it out and rinse your mouth out with warm water. Repeat the process daily in the morning before eating anything. You can also do oil pulling with extra virgin coconut oil. Do not gargle or swallow the oil. Number 3 is sage. Irritated or inflamed gums due to the denture pain can also be treated with sage. Its anti-inflammatory properties help to reduce the gum pain and swelling. This antimicrobial this antimicrobial herb is also toxic to the harmful organism like cause bad breath and impact your oral health. Boil 1 tablespoon of the dried sage in 1 cup of the water. Strain and allow it to cool. Use the water to gargle 2 times daily until the swelling and the pain are gone. Also chew a few fresh sage leaves 2 to 3 times a day to help release the pain and reduce the gum swelling. Number 4 is figs. A popular historical remedy for the denture pain is figs. Figs helps to treat the mouth sores associated with wearing dentures. The several nutrients in the fruit as also help to reduce the pain and swelling. Cut a fresh fig in the half and place a half teaspoon place 1/2 in your cheek and the sore gums. Place the inner part of the fig towards the gum and keep it in place for some time. Spit it out the fig and rinse your mouth off with lukewarm water. Repeat twice daily until the pain is gone. Number 5 is maintain proper hygiene of your mouth and denture. To prevent the bacteria from residing in your dentures, you must clean them regularly. Proper care will help to keep them free from stains and looking their best. At the same time, even if you have false teeth, you will need to maintain oral hygiene to prevent the pain and swelling of the gums. Oral hygiene will also reduce the bad breath. Use a soft toothbrush to clean your dentures and tongues and gums and roof of your mouth twice daily. Always remove your false teeth at night. Soak your denture overnight in a water, denture cleanser or diluted vinegar solution to loosen the debris. Rinse your denture with water before putting them back into your mouth. Whenever possible, remove your denture after eating and rinse under your drinking water. Additional tips: if your denture do not fit properly in your mouth, consult your dentist. If you have trouble speaking after using your denture for several weeks, consult your dentist. Handle your dentures carefully and avoid bending that chaps and eat soft foods drinking the first few months for the wearing dentures. You can try soft foods like stew, pasta, vegetable soup, appliances, pudding and yogurt. Make sure you chew your food slowly and thoroughly to reduce the gum discomfort and avoid raw, sticky and crunchy foods that can irritate your gums. During the initial weeks of the wearing denture, you may experience a decreased saliva production. Suck on a lozenge to increase. Do not use bleaching products as they can damage your denture. Avoid using toothpick as well. Never hot or boiling water to clean your denture as it can distort the shape. Have your dentures checked yearly. They typically need to be replaced after a few years.